Hello guys, my name is Abdul, and the topic that I chose for my final project is what is a crown. So today we are going to talk about what is a crown. So a dental crown is basically a tooth-shaped cap that covers and protects a damaged or weakened tooth. It is designed to restore the tooth original shape, size, strength, and appearance. It is you can think of it as an armor for your tooth. It fits over the visible part of the tooth above the gum line and keeps it safe from further damage. Dentists usually recommend crown when a tooth is cracked, has a large filling, or has gone through a root canal, and it helps with extra support too. They can also be used to improve the look of the tooth that is discolored or misshapen. Once a crown is cemented in place, it functions as just a natural tooth. You can eat, chew, and speak normally with it too. Crowns are custom made for each patient so they can match the color and shape of their surrounding teeth. They can be they can be made from different material like porcelain, ceramic metal, or even from both. Porcelain crowns are popular because they blend in naturally with your other teeth, while metal ones are stronger and they last longer. So in simple terms, a crown job is to protect what is left of the tooth, restore how it looks and feel, and help you maintain a healthy and confident smile. Now we are going to talk about why would somebody need a crown. So there can be a few reasons that somebody would need a dental crown. The biggest reason is to protect a weak tooth or to cover a damaged tooth. For example, if a tooth is cracked, wore down, or has large cavity that cannot be fixed by just a filling, a crown helps it hold it together and prevents it from breaking down. Another common reason can be after a root canal. When a tooth has a root canal, it loses a lot of its inner structure and becomes weaker over time. A crown covers and protects it so the patient can chew normally without worrying about the tooth to get cracked. Crowns can also be used for cosmetic reasons, like covering the discolored teeth or misshaped teeth to improve someone's smile. Crowns are also used to restore a broken or a worn down tooth, like some people when they grind at night. Mm, that in those cases, a crown brings the tooth back to its normal uh, shape and size. So in short term, crowns are really versatile. They protect, restore, and improve the function and appearance of a tooth, which is why they are such an important part of modern dentistry. All right, now we are going to talk about different types of crowns. So number one, we have porcelain or ceramic crown. These are the most popular. These are the most popular for the front teeth because they look the most natural. The color matches the surrounding teeth really well, so you cannot even tell it's a crown. So the only downside is that it can sometimes be less durable for heavy biting. Next are metal crowns, like gold or other metal alloys. These are super strong and last a long time, which makes them really great for back teeth where most of the chewing is done. The only issue is that they are not teeth colored and they are more visible if you use them on front teeth. Then there are porcelain fused to metal crowns. These combine the strength of metal with the natural look of a porcelain crown. They are very common because they offer a great balance between appearance and durability. Though sometimes the metal underneath can show as a dark line near the gums. We also have zirconia crowns, which are becoming really popular. Zirconia is very strong and still looks natural, making it a great all-around option. So overall, the type of crown depends on where the tooth is, what the patient, if the patient wants it to look, or how strong the patient wants it to be. Now we are going to talk about the different type of instruments that are used for a crown procedure. First, we will start with the mouth mirror. That's the tool that lets the dentist see all the angles of the tooth and check for decay or cracks. Then we will use an explorer or a probe, which helps detect soft spots or cavities in the tooth that might affect the prep. Next, one of the main tools is the high-speed handpiece, or you can call it the dental drill. This is used to shape the tooth so the crown will fit correctly over it. We also use burrs, which are the tiny attachments that go on the drill. Different shapes and sizes help with cutting, smoothing, and finishing the prep. Then we will use a triple syringe, which is also used to rinse and dry the area with air and water, keeping the tooth clean and visible during the process. We'll also use retraction cord and cord packer to gently push the gum tissue away from the teeth. This gives a clear margin for taking an impression. Then comes the impression tray and impression material. These are used to take a mold of the prepared tooth so the lab can design the crown to fit perfectly. Finally, the temporary crown material and cement. These are used to make and place a temporary crown while the permanent one is being made. All of these tools work together to make sure the crown fits correctly, feels comfortable, and looks natural once it's placed. Now we are going to talk about the process of doing a crown. So first, the dentist will start by examining the tooth and taking x-ray to check the roots and surrounding bone. This helps determine if the tooth is healthy enough to support a crown. Next, the area is numbed with local anesthesia to make sure the patient is completely comfortable during the procedure. Once the tooth is numb, the dentist uses a high-speed handpiece to remove any decay and shape the tooth. This shaping creates enough space for the crown to fit naturally with patient's bite. After that, the retraction cord is placed gently around the tooth to move the gum tissue slightly away, which helps exposes the margins for preparation. Now that's done, the dentist takes an impression using a tray filled with impression material, and this impression is sent to the lab to make a custom crown for the patient. While the permanent crown is being made, which can take about 2 to 3 weeks, the dentist creates and places a temporary crown. This protects the prepared tooth and keeps the patient's smile looking natural. While the permanent crown comes back from the lab, the patient returns from a final appointment. The dentist removes the temporary crown, checks the fit and color of the new one, and then cements it permanently. Finally, the dentist makes a small adjustment to ensure the patient bite feels comfortable and natural. So there you go. That's the whole process of doing a crown.